Good evening, everyone. So, as you all are aware, that we are concluding today a Bone and Joint week, which was the initiative of Indian Orthopaedic Association, and Delhi Orthopaedic Association was celebrating it for last 7 days and have conducted lots of activities under the leadership of Dr. Ajay Shukla, who is our president, and Dr. Sandeep Kumar, who is our secretary. Dr. Sandeep Kumar is still with us. So, today in that series, in online events, we are conducting a webinar with an eminent speaker from Patiala, Dr. Aggarwal, who is currently the professor at Gian Sagar Medical College, and he has lots of things to his head. So he will be speaking to today on how to prevent fragility fractures in elderly persons and power of exercises in promoting healthy aging. So I have also experienced these exercises with him long back. So definitely this lecture and his presentation will be so informative to you, and definitely you will all gain a lot of things from his presentation. Now, to move further, I would like to invite our Secretary of Delhi Orthopaedic Association, Dr. Sandeep Kumar, to have a few words. Sir, Sandeep sir.
Good evening to all the participants who are listening to this webinar. As rightly said by Dr. Ravi, this is one of the series in continuation with the Bone and Joint Day webinars, which is an initiative of Indian Orthopaedic Association. And today we welcome Dr. Aggarwal sir for a talk which is very, very important, I believe, in prevention of fragility fractures. So I think we will not waste any further time, and I'll just invite Dr. Aggarwal sir to start his talk. Thank you.
Thank you, Dr. Ravi and Dr.
Sir, you can share your screen now.
Dr.
Vinay Aggarwal, basically, who is also working in BLK Hospital as a consultant orthopedics. So he is our panelist for today's session, along with Dr. Karun, who will be moderating today's webinar. So welcome, Dr. Vinay.
Thank you, sir.
Welcome, Dr. Vinay.
Thank you, sir. Thank you.
Whether my screen is visible?
Yes, sir. Yes, sir. Yes, sir.
Okay. Thank you, Dr. Ravi and Dr. Sandeep, for your kind words. First of all, I am thankful to Dr. Ajay Shukla, President DOA, Dr. Sandeep Kumar, Secretary DOA, Dr. Ravi Chauhan, Treasurer of the DOA, for giving me this unique and golden opportunity to share my experience about how to remain fit. And I think fitness is always of prime importance, especially for the orthopedic surgeon, that we should always remain fit so that we are role model to our patients. And as there is a IOA President theme, old is gold, 360 care for the elderly to ensure mobility, dignity, and longevity in the elderly person. So, dear friends, today I share my greeting from the place from where the Patiala peg has originated, and I hope everybody enjoying the Patiala peg in their parties. And my talk is focusing on the pregnant theme only, how to ensure the mobility, dignity, and healthy longevity of the life in the elderly person. As you all know, fractures are common in the elderly age, and as per the literature, 1 in 4 adults after the age of 65, they are going to experience the fracture, experience the fall, and most of the time these are the hip fracture, which involve lot of cost for their management. And beautifully, most of these fractures, they are preventable if we are able to maintain the muscular balance and prevent the fall. That will ultimately reduce the cost burden over the family. And dear friends, osteoporosis is silent killer. Most of the time, all these fractures because of fall, they are because of the osteoporosis, and person may not know that they are suffering from the osteoporosis until a bone fractures. So, dear friend, osteoporosis should not be taken as a joke. We should all take it very seriously. So, before I start my further webinar, I will like everyone to just go through this video, just see this video. Most of the time, this is the mode of fall in the elderly person. She is a 75-year-old osteoporotic patient. She was advised to walk with a stick by me only. But while moving in her house, she fell like this. So this is the most common type of fall in the household. And there are other modes of the fall leading to the fragility fracture. And most of these fractures and falls can be prevented by taking certain preventive measures. And these are the other modes of the falls which lead to the fragility fracture. The most common is the elderly person, they try to reach the high places by standing on a table or stool. Ultimately, they lose the balance or suffer from a fall leading to fracture. Loose electrical wires, most of the time, they are lying in the household when they are moving around, and they just trip down because of the loose electric wires. So, because of the significance of the osteoporosis, even all over the globe, World Osteoporosis Day is celebrated every year on 20th October, so that we should create health awareness among the public, especially the elderly person, to prevent their fall by ensuring their improvement in the muscle balance. So why, dear friend, we are discussing osteoporosis nowadays so frequently? Because the life expectancy is increasing. In 1900, people were considered old in their 40s. But nowadays, even person old than more than 80 years old is not considered as the old. There is a phenomenon increase in the life expectancy. Just take it like that Amitabh Bachchan is more than 80 and still he is giving a big challenge to the younger generation. So we should never feel old and keep walking till the final call. You can feel young, dynamic, energetic, always by doing some physical exercises. So here I am giving the example of two elderly Indians who created history. Mankor, she was running till the 105 year of the age, and Foja Singh, who recently died, he was running till the last day. So keep moving till the final call. That will keep you active, prevent the fall, and ultimately fragility fractures, they are reduced. As a doctor, we all should look smart, active, energetic by maintaining good health. We should be role model to our patients, friends, family, relatives, and society. Exercise reduce the risk of depression, diverticulitis, heart disease, stroke, and many cancer, and prevents the early death. So such is the importance of the exercise. So dear friends, as you all know, osteoporosis is an ongoing process which lead to gradual weakening of the bone, which result in decreased bone strength, and ultimately there are increased risk of fractures. And just to remind about the osteoporosis process, bone resorption period has a median duration of 3 weeks, which is followed by the bone formation, which is over a period of 3 months. So normally the bone resorption with the new bone formation, whatever the deficit has been created with the bone resorption, that is completely filled up. But after the age of 35, bone resorption exceeds the bone formation, and there is a net deficit which leads to the formation of big holes, weakness of the bone, and ultimately leading to osteoporosis. So, dear friend, osteoporosis is nothing but imbalance between the bone formation and bone resorption. And various type of fractures because of the osteoporosis, they are the vertebral fracture, hip fracture, distal radial fracture. Otherwise, any bone can get fractured because of the osteoporosis. Here, it's very important to understand the concept of the peak bone mass. Peak bone mass is the amount of the body tissue present at the end of the skeletal maturity. Indirectly, peak bone mass is the bone strength achieved at the end of the bone, at the end of the growth period, and it is an important determinant of the osteoporotic fracture risk. Dear friends, if you just look over this diagram, it shows that there is an increase in the peak bone mass only up to the 30 year of the age. That's the age of the childhood or the adolescent. After 30, you can maintain it up to 40 and 45 years of the age. After that, there is a decline in the peak bone mass, which is more in the females. So, peak bone mass can be attained only up to the 30 year of the age. That's why we should encourage children, younger generation, adolescent by doing the outdoor activity in the presence of good nutritious diet, because peak bone mass is the ultimate indirect evidence of the your risk of osteoporotic fracture. And females are more prone to osteoporosis in the, especially in the menopausal age, because of the deficiency of the estrogens. And there are so many risk factors which lead to the osteoporotic fracture. They are primary risk factors, secondary risk factors, but the most important ones, they are use of the alcohol, steroid use, low calcium level, low estrogen level, smoking, or the sedentary lifestyle. And we can easily remember these, the important risk factor by the mnemonic of assess. So, dear friends, there are few symptoms with the osteoporosis. That's why it's known as the silent killer. And sometimes the cleft vertebral fracture, because of the compression, may lead to severe backache or stooped type of the posture in the back. Otherwise, most of the time, person does not know that they are suffering from the osteoporosis until their bone fractures. And there are some signs which can indicate about that person is suffering from the osteoporosis, especially in the vertebral fracture, that there may be loss of the height, kyphotic deformity, there may be chest deformity, protuberant abdomen, or the rib pelvis overlap. So, diagnosis of the osteoporotic fracture is made by the fragility fracture. Once a patient suffers from the fragility fracture, it's a clear-cut evidence that he is suffering from the osteoporosis, but we can document it by the bone mineral density, by knowing the T-score value. As per the WHO, the normal T-score is up to -1, and if the T-score is less than -2.5, then we label the patient as a case of osteoporosis, and if they are in addition having the fracture, then they are labeled as a case of severe osteoporosis. So now how to deal with their osteoporosis so that ultimately we can be able to prevent the falls in these persons which lead to the fragility fracture. So to decrease the risk of the fragility fracture, we have to improve the muscle balance by dealing with the risk of the osteoporosis. As physicians, we all know that prevention is better than cure. So improvement in the lifestyle modification, like stop smoking, avoid too much drinking of the alcohol, high protein diet, 1 gram per kilogram body weight daily, adequate amount of the calcium and vitamin D in the presence of exposure to the sunlight. But the most important out of them is adequate physical exercise. Everything in addition to the physical exercise that will work. Without physical exercise, these things are not going to play much role in the prevention of the osteoporosis. Then how much exercise should be done daily or educated to the patient that how much exercise they should do? The brisk walk for 30 minutes, at least 4 to 5 days in a week is good enough. to take care of their muscles of the hips and lower limbs. Weight bearing exercises, they are good for preventing of the osteoporosis. Then for strengthening of the spine muscles, we can do these type of exercise, and the resistance exercise with the dumbbell, they can be done for strengthening of muscles of the upper limb. So these are the simple exercises which we just educate to our patient. These will go a long way in maintaining their muscle balance and improving their health. And out of all exercise, for lower limb, the weight bearing exercises are more significant. And the weight bearing exercises are walking, running, jogging, jumping, going upstairs, coming downstairs, playing games, dancing. They are all weight bearing exercises. Cycling and swimming, they are non-weight bearing exercises. Why the weight bearing exercise? They are considered good for prevention of osteoporosis, because these exercises, they make your muscles work against gravity. That's why they are more significant than the non-weight bearing exercise. So dear friends, exercise is powerful medicine for osteoporosis, and we should educate all elderly person to indulge in some kind of the exercise, and simply doing meditation is just for relaxation of the mind. And I just want to tell you that there are basically 4 types of exercise. If you just group them to know that which exercises are good for us, they are endurance exercises, strength building exercises, balance exercises, and stretching exercise. And in the endurance exercise, they are the walking, swimming, dancing, cycling, aerobic exercise, and the lawn mowing. This is very good for the elderly person. All these exercises, they increase your stamina to work, to do more exercises, but they sometimes may not lead to strengthening of the muscle. To strengthen the muscle, they are strength building exercise. Like we are doing the exercise in the gym. Weight training exercises against resistance. Then free weightlifting for upper limb. All these exercises, they are the best type of exercise if person can do these exercise. Especially in the after 50, we should all encourage our relative, friends, person in the society, and the patient to start doing some type of the strength building exercise to take care of their muscles of the limbs. Then there are balance exercises. These are standing on one foot, getting up from a chair without support. All balance exercises, they will prevent falls in the elderly person, so ultimately leading to less chances of having the fragility fracture. Then there are stretching exercises. These exercises lead to increase in the flexibility of the joints. Yoga is the best type of stretching exercise, and ultimately all these exercises, they lead to better muscle control. So dear friend, for preventing the falls in the elderly person, we should just make out some strategies so that we should be able to prevent the fall, and we can magically prevent these fall by taking certain preventive measures. If we can tell the patients that these measures are to be taken, only then they will be aware about these things. And these can be few measures which I am just going to demonstrate, that provide adequate lighting in the living area. Tell them to avoid walking on the slippery surfaces. We should review the drug regime which lead to the dizziness in the patient in the elderly age, which may lead to increase in the response. Sometimes we are able to replace the medicine with the those who doesn't cause dizziness. So ultimately that will also help in decreasing the risk of falls. Then they must use walking aids, especially patients who are having comorbidity. Sometimes these patients feel shy in using the stick or walker, but we should encourage them to use the walking aid to prevent the falls. then they must visit the ophthalmologist regularly for their vision checkup. And we should tell them to improve the lighting around the elderly person's living area, and light switches should be easy to access by them. Adequate night lamps should be there for getting up in the middle of the night. Sometimes, because of the pressure of the urine or toilet, they have to get up in the middle of the night. So, proper arrangement for the night lamp should be made, and remove the unwanted extra furniture from the living area of the elderly person to reduce the chances of the falling down. And the most important one, which is very common, that we should encourage these person to wear clothes, shoes, and socks in the sitting position. That will help in easy to maintain their balance. And this is most common in the bathroom. After taking bath, they try to wear the undergarments in the bathroom in the standing position, which promote their falling. So this is a simple thing we should take care of to decrease the risk of falling down. And mount handle bars near the toilets on both inside and outside the bathtub and the shower, so that it is easy to make their position for taking bath. Bathroom should be well lighted, especially leave a light on it in the bathroom at night. Place non-skid mats or the carpets on all surfaces, because if the mat gets wet, the person should not fall down because when they are walking over the mats. And we should encourage them to take bath or shower in the sitting position in the washroom. These are, I think, the very, very simple thing which we all are doing, but sometimes we just do not convey to our patient, or sometimes elderly person do not give significance to these things. They are very important to prevent the falls. And we should ensure that there are handrails on both sides of the stairs, and they must hold the handrails while going upstairs or downstairs. Consider using the motion activated lights that automatically turn on to help illuminate stairwells and the pathway, and they will definitely help the person to maintain the balance. Keep the floor neat and clean. Do not leave books and paper, clothes, or shoes on the floor. Carpets should be firmly fixed to the ground, so that person should not fall down by just getting entangled in the edge of the carpet, which is loose, which happens most of the time. And do not walk on the slippery floor, especially when it has been recently washed. So these are the common modes of the falls, especially at home. Put night lights and light switches close to the bed of the patient. Place a mobile or the landline phone near the bed of the patient. And if sometimes there are steps near the front door, when you have to get inside the house or you have to go outside as well. Take care that steps are not broken or they are not even uneven, so that while going out of the house or while coming inside the house, they should not fall down. They must carry the mobile phone when they are going out of the house for any emergency, and consider installing a grab bar near the front door so that it will provide a balance while locking or unlocking the door. This is sometime a problem that while person is just locking or unlocking, they don't have the balance. So better there should be a handle to hold on. Then remove the loose wires, loose item that could lead to tripping or falling. Arrange furniture or other objects so that they are not in the way of walking. And the most important, as I have told, that tell them do not stand on a chair or stool to reach something that is too high, because there are high chances of falling down. And now I am going to tell you simple exercises which you can tell to these patients. They will definitely lead to improvement of the muscle balance, increasing the stretchability, range of movement of the joint. Simple exercises which everyone can do. And you can see that the person in the video is me. And these are the simple exercises which one can do at home, nothing going to gym or anywhere. I think very simple one. Simple exercise. Stretching, movement, balance exercises, they are ultimately going to increase the muscle balance of the person, preventing the falls, and ultimately they are leading to the fragility fractures. And someone who can do much more than that, that there is a routinely we are doing forward running, but the backward running, I think that's good to increase the strength of the muscles of the back. Then step exercise, they are relatively for the younger person, or you can those who can do it. This is the best aerobic simple exercise. By simple doing step exercise, tell the person to start them for 1 minute a day, then gradually increase to 5 minutes in a day. And this is a good one for everyone. I will encourage and advise all of you to just experience for doing the step exercise. If you are doing it for 15 minutes, you lose lot of sweat simply by doing the step exercise. And this is the again side to side running. There was backward running for the strengthening of the back muscle, and this is side to side running for strengthening of the collaterals of the knee joint. I think these are better than simple walking or just forward running. And the balance exercise is standing on one leg, if one can, that will definitely improve their muscle balance to a great extent. Then Surya Namaskar, this is the ultimate. If one can do the Surya Namaskar, this is going to lead to the stretching of almost each and every joint of the body, and stretching and flexibility in the joint which you are going to experience after doing the Surya Namaskar is ultimate. There are 12 different type of posture in the Surya Namaskar, I think which you all might be knowing, and there are beautiful statues at the Terminal 3 at International Indira Gandhi Airport, which you all might have visited. So definitely that is best for increasing the muscle balance. And the mother of all asanas, Shishasana. I am sure that many of you might be doing this thing, but I am practicing it till date, and I think that's the secret of my keeping myself fit. So, dear friends, in conclusion, exercise is powerful medicine with no side effects, and as everyone, especially in the elderly person, is going to suffer from the cervical problem, back problems, and the knee problem. So I am just, this is just my endeavor to show these few exercises which we all know, and everyone is demonstrating to our patient, but they will go in a long way if we tell the patient to how to keep the strength in the muscles of the neck. This will ultimately prevent them for suffering from cervical problem, and common problem is osteoarthritis in the elderly age. Everybody is suffering, and they are ultimately going for the replacement of the knee joint. If they start doing the quadriceps strengthening exercises in the early age, either in the supine position or in the sitting position, especially with weight, they will definitely strengthen their muscles around the knee joint. And ultimately, we all know if we strengthen our quadriceps muscle, then the mobility of the knee joint is increased, and the less chances of patients suffering from the osteoarthritis, and less chances may be there going for the knee replacement. And there are few demonstration of the exercise, because most of the time all these persons, they are either suffering from the cervical problem, back problem, or the knee problem. So these are the simple exercises for strengthening, and they will ultimately increase the flexibility in the muscles of the spine. The most important, I think, point is when we are telling these patients how to do the exercise, we must tell them about the significance of what, when, where, why, and how. Sometimes they are in habit of doing the exercise over the double bed only. I am of strong belief that these exercises should not be done over the bed where the patient was sleeping, because you didn't get that type of feeling while doing the exercise. And they should be done especially on the floor, on the hard surface, because most of the time the patient are not comfortable while sitting on the floor, so they can do over a bed without mattress, but they should definitely be done on the hard surface, and they should be done with full dedication, devotion, faith, and belief that I will get relief out of these exercises. Doctor has told me to do these exercise in this way. If I will be doing the exercise in this way, only then I am going to get the relief. And this type of the feeling, if the patient have their mind in their mind, only then we can expect good outcome out of the exercise. And if we simply just tell them do this exercise twice a day, thrice a day, that may not give that type of relief. So the place where they are doing the exercise that carries more significance. And I always advocate my patients that most of the patients, they have puja room in their house. So better nowadays we should have a exercise room in their house where once we enter that room, we should start feeling that I have to start the exercise and then I will start enjoying the relief out of the exercise. That emotional type of the feeling are definitely going to give much relief to the patient and better outcome out of the exercise. And definitely, if the person has been diagnosed as a case of osteoporosis, then there are so many anti-diuretic drugs or the anabolic agent, which we all know in the presence of good nutritious diet, we can tell these patients. So, dear friends, the summary of my talk is that tell the patient to avoid walking on the slippery surfaces, use walking aids in the especially when they are having the comorbidities, and the regular eye checkup is very, very important, and adequate lighting of the living area, especially the bathrooms, especially when they have to get up early in the morning, in the middle of the night, they should be comfortable, no chances of falling down. We should try to declutter the area with the extra furniture if that is there in the living area. Wear clothing, shoes, and socks in the sitting position to maintain the balance, and tell them to hold handrails while going upstairs, downstairs. That's very, very significant. And the 30 minutes of the regular exercise, especially the weight bearing exercise, they are the good exercise to prevent exercise. And out of these exercises, strength building exercises, they are the best one to prevent and treat osteoporosis. And you can rather tell these patients that if they are able to do the strength building exercise, they will regain their power. That will decrease the sarcopenia, and ultimately their osteopenia can be reversed to a great extent, and ultimately less chances of falling down because of the osteoporosis. So less fragility fracture, and in that way they can definitely enjoy their healthy living. So dear friends, walk, dance, run, do yoga or cycling, whatever you do, but we as a human being, we should also do and tell our friend, relative, and society to do all these things so that we should not let osteoporosis to take away our freedom. And lastly, this pictorial diagram is very close to my heart, and I am of the strong opinion that we all orthopedic surgeons should display this type of chart in our OPD. This chart is complete in all respects. This is telling the etiopathogenesis of osteoporosis, how the osteoporosis lead to weakness of the bone, big hole formation. Then these are the risk factor of the osteoporosis. Gender, females are more prone to osteoporosis than the elderly age. then obesity, then now there are few symptoms, but some patient may suffer from symptoms of the osteoporosis like backache if they are having a compression fracture, and there are risk factors. So ultimately, we should take care of the prevention of the osteoporosis by just lifestyle modification about stopping smoking, avoid taking alcohol, good nutritious diet in the presence of sun exposure, and tell them to do the outdoor activity, indulge them to do some type of the strength building exercise or the whatever exercise they can do. If required, they can take few medicine, but prevention will definitely go a long way. So thank you very much for your patient hearing, and I am really honored and blessed to present this webinar in the platform of the Delhi Orthopaedic Association, which is a unique and a wonderful type of the webinar because it is being held during the Bone and Week Celebration Week, which is a mission of the Indian Orthopaedic Association. Thank you very much. I thank my webinar with the quote by Swami Vivekananda that rise, awake, and stop not until the goal is achieved. Thank you so much.
Thank you, sir. It was such a informative and explanatory presentation. Then
I hope I have not bored you.
no, sir, you have not bored us, but actually it was really informative to have a lot of things. Actually, I think all must be convinced with me that this lecture will be beneficial to everyone, and especially for the general public when they hear this lecture. So I would like to invite.
Actually, my motive was not only the elderly person or the patient, but we people as orthopedic surgeon also.
Yeah,
That we
exactly,
should also
exactly,
try
sir,
to
exactly.
keep ourselves fit by
Yeah,
doing. Definitely, you people are doing some exercise, but sometimes just you can have an idea for the easy way out.
No doubt, sir, no doubt.
Sir, the best part is that not only inspiring, because you were yourself there in the videos showing the exercises and how to do them. I think that is the most aspiring for all of
Yeah.
us.
Yeah,
Thank you,
We
that's
sir.
really
talk
Thank you.
about, we
encouraging.
give didactic lectures and do everything, but here you have shown that how it can be done, and you yourself are the subject and showing all these things. It is
Sir,
really very, very good, sir. And we
sir,
all are inspired by your talk.
So
I am 63-year-old, and I think these are not the simple thing. I am till day I am doing even the Shashasana. I can do it for 10 minutes. Step exercise I am doing for 20 minutes. So I don't need to feel the need to go to gym. And this
That
is
is what I am saying, sir. Going to gym is a myth. It is not required actually. For your fitness, you can easily do home based exercises and
yeah,
they
yeah,
can always keep you fit without letting the osteoporosis be a silent killer in your life.
yeah.
So
If you are you are fit, then you can tell your patient that you should do something to
सर
keep yourself fit.
ये बड़ा टफ क्वेश्चन है सर.
नहीं, वैसे
And
मरीज कभी कभी कहते हैं सर कि अरे डॉक्टर साहब आप भी बीमार हो जाते हैं क्या? इसीलिए डॉक्टर्स को अलाउड.
one of my I was telling to my patient, one of the osteoarthritis patient to lose weight. So she was quite outspoken. She told me, "Sir, have you reduced your weight?" So how
sir,
difficult it is to reduce a.
sir,
मैंने कहा,
sir,
yeah, exactly.
once on a social platform, I demonstrated how to do the Surya Namaskar.
I have experienced that. I have experienced
Yeah,
that in basically in Corbett.
because,
So yeah, with
so,
you. So
so
anybody having any question, Dr. Vinay?
Thank you, Dr. Hariom Agarwal. It was a very comprehensive and very beautifully demonstrated presentation. You have covered almost all the topics which are relevant, starting from osteoporosis, the pathophysiology, the risk factors, the diagnosis, how we make it, and also the best part, as Dr. Sandeep and Dr. Ravi sir have already said, that you have yourself the subject, you have demonstrated exercises,
Thank
and the
you.
best and the thing that you told, that it's very important for orthopedic surgeons, and that's very that's the most important thing, because it's our surgeons are very demanding either ways. And if we don't keep fit ourselves, then not only we can't be a role model for our patients, but also we can injure ourselves during surgeries. So, sir, one point I would like to, just to start off the discussion, that when you mentioned about the risk factor for osteoporosis. So,
Yeah.
what is your cutoff age or cutoff patient type when you decide to do a DEXA scan? And what is your cutoff in terms of the reports of DEXA scan? What is your cutoff threshold of starting them on any anti-resorptive or bone formation medication, like anti-osteoporotic medications? What is your, like, how do you go about it when you deal with osteoporosis?
So number one, most of the time I do not ask for the DEXA scan if the patient is keeping himself active even after the age of 60 or 65. But when you come to know that a patient is lethargic, they are having bone pain, postmenopausal ladies, and they are having, complaining of so many problems, osteoarthritis, they are having feeling difficulty in walking. Then after the age of 60, I do recommend that go for the DEXA scan. Because if the DEXA scan is showing that their T-score value is less than minus 2.5, then you may like to add some anti-resorptive or the anabolic treatment. But for adding the treatment for the osteoporosis, if the patient is symptomatic, only then I prefer to add these things. If the patient is keeping himself active, then simply calcium and vitamin D, I think that's good enough. So the treatment for osteoporosis is only for those who are diagnosed with the BMD, that T-score value is less. And if it is nearing minus 2.5, then I try to add the anti-resorptive drugs.
Thank you, sir.
And the most important is register in the mind of the patient how to do the exercise, where to do the exercise, when to do the exercise. So if you just tell them, the patient, that don't take the breakfast before doing the exercise, and if the patient is suffering from the osteoporosis, then I tell them to do the exercise 3 times a day: before taking breakfast, before taking lunch, before taking dinner. And this is my methodology of exercise, that when to do, where to do, how to do. I always compare them that as you all are having puja room in your home, and you do puja in the puja room only. You are not doing puja over the bed. So you should not do the exercise over the bed where you were sleeping. Then you are not going to get the feeling of the better outcome out of the exercise. I think this type of the emotional attachment with the patient definitely going to help you, and they will start doing exercise. And if we are able to motivate them to do the exercise, I think our purpose is done. And the medicine, in addition, they will definitely do something, but the best will be the exercise part. This is just my way of telling these patients that how to start the exercise. And most of the time, this is the way that we just tell them that do the morning evening walk, or do some exercise, or for the just go to the physiotherapist for doing the cervical exercise, osteoarthritis or quadriceps exercise. Because we need to tell them do the exercise 3 or 4 times a day. Nobody can go to the physiotherapist for 3 or 4 times a day. And if they are doing one time even to the physiotherapist, they will not do the exercise at home. So tell them to understand how to do the exercise, then do them at home only. That's the better way out. And definitely you will realize that this has given a better outcome in our patient.
Definitely, rightly pointed out, sir. But sometimes it's difficult to demonstrate the exercises in the VZOPD, and sometimes
Sir, so you just ensure that your physiotherapist perform this job, which is to be performed by you.
Yeah, exactly.
Yes.
But whenever I have time, I usually demonstrate them myself.
Yes. or tell your physiotherapist that you have to perform your duty like this only.
Yeah.
And
Otherwise,
that,
usually patient, they don't do the exercises when you ask them.
yes. Most of the time, patient will not do the exercise.
Some
You
of them
just
have
see after
paralysis.
the knee replacement. Once the knee replacement is done, they will sincerely do the exercise for 1 month or so, 2 months. Or when they start moving comfortably, after then they just stop doing exercise.
Nobody
Nobody do
point
that.
is they are not in a habit of doing those things.
Not doing
So that's the problem with the habit, not
Sir,
basically not knowing. Basically,
I
lots of
also give the example to the patient that when the patient has got the stent, they develop the habit of doing the morning evening walk. After getting their cardiac surgery or some time of intervention, they develop the habit of doing the morning evening walk. So
it comes
they
with
are
a
compared.
it comes with a fear, sir.
So that type of fear you have to create in all these patients that
Yeah,
then
they actually, as we all basically, whosoever is taking the lecture on osteoporosis, now we are saying it's a silent killer. So they must be getting afraid of that point. I think it's a silent killer.
so
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 let's see. Yeah.
yeah,
Otherwise,
this is
it's
very important task, very difficult task. But patient will do the X-ray only for, see the patient with the cervical problem. They will do the X-ray only for a few days. Then they will stop.
exactly
But
they
if you
don't
will
stick to it.
create fear in them, then definitely, gradually, they will start doing this thing.
No doubt, sir. No doubt. Dr. Karun, are you there? Manoj, sir? Manoj, what, sir?
Yes, I am there, Ravi.
Sir, we would love to have your comments, sir.
Thank you, Dr. Manoj, to hear your voice.
Oh, it's mind-boggling. I was scratching my head all the while listening to Dr. Hari Om. I was wondering what else could I add? Really, I could not find anything which I could really add. All I want to share that his stress on exercise is really, really important. And from my own personal opinion, Dr. Hari Om says he's 63, I'm 71. And for last 15 years, I've been employing a personal trainer. I work out in the gym. I lift dumbbells from 10 kilos to 40 kilos. And the trainer is very particular. He says the most important part is, developing strength in the lower extremity. Half the muscles are in the lower extremity. So laying, laying stress on strengthening the lower extremity is very important. So basic exercise like lunges and half squats and doing on the steps and calf raises, all those are those simple exercises, but which go a long way in preventing falls.
Yes, sir.
And another point which I stress upon the patient is I carry a small model of osteoporosis, which has, 4 plates. I tell them this is for the 30-year-old, this is for 45-year-old. Stage 3, you see how the bone looks. Stage 4 is really scary. So probably that puts a little bit of fear in their minds.
Yeah.
And I do try that they try, but I find there's a lot of resistance to taking medicines for osteoporosis. Despite all the counseling and everything, the moment you tell them injectables, they are quite averse to, despite a very poor T score, they are not easily, convinced that they require treatment for osteoporosis.
Yeah, sir, you are very much right.
Actually, problem is this, sir. What your mind don't know, your eyes can't see. So
Yeah.
that's the problem. Basically, they need to know how harmful the osteoporosis is when it comes to their fractures, when it comes to their basically bone strength and all those things. So people are not aware of these facts actually, like significance of fractures in this population and the weakness of bones and all those things actually.
Sir, I just want to add one thing that we should, most of the time, patients, they are in doing the habit of doing the walk. Sometimes they will say that I am doing brisk walk. These are the things they will lead to strengthening of muscles of the lower limb. But strengthening of muscles of the upper limb, this is also very, very important. And that can simply be done with the dumbbells or other distant type of the exercise. And I will advise to all my orthopedic brothers that when they have to do the surgery on the day, before that day, early morning, they should do upper limb strengthening exercise for 5-10 minutes. And you all might be knowing that person in the elderly age, They are not worried about their white beard. They are not worried about their decreased vision. They are not worried about the decreased hearing or hearing loss. They are worried about the strength in the lower limb, that I am not able to walk. Most of the elderly person, they will say that I am not able to walk. They will only complain about this thing. So if we tell them to do these exercise at the beginning, early age, at the 60, most of the time they are quite active. When they reach about 75 or 80, definitely they start experiencing these things. Today morning, we were having a health camp up, and one patient came to me for checkup. You will not believe that he was 92-year-old. He was 92 and he came to me for blood pressure, and otherwise he was walking around normally, and you cannot say he was 92. He was saying, I am doing 1.5 hour morning exercise, some type of the gardening at home and everything. So definitely these things go a long way to keep themselves active and prevent their fall from the ultimately leading to a fragility fracture.
Thank you, sir. Thank you.
So I hope I have been
Dr.
able
Vinay,
to
you
do
want to add
justice.
something?
Yeah, sir. Of late, like obviously, we also advise many people about exercises in OPD, and nowadays, I'm talking about the Delhi perspective. That obviously people come with a lot of gadgets and apps and all those sort of things. And there is a recommendation from a Danish study, I think recently, that 10,000 steps are recommended for something like a cardiovascular fitness. At least there was 7,000 steps. So, what is your take on this? Like, do you like is the duration of walking or the number of steps? Or do you advise, in your practice, do you advise the people to have some kind of gadgets like Strava app and Samsung Health app to count the number of steps? What is your take on this? Like in terms of in terms of
Well, actually,
objectifying the exercise?
yes. Definitely, this has nowadays become the fashion because of the electronic era, that everybody is wearing the Apple watches and they're counting their steps. But I think whenever possible, wherever possible, if your person is not able to do the exercise at home, do the walking at the workplace. I always advise that whenever possible, keep on moving. Don't take the help of the lift. Take the help of the stairs. Go upstairs, downstairs, move around. Don't feel yourself lazy. Sometimes you are depending upon your subordinates for something. It's better to move around yourself. And definitely more than 10 steps, 10,000 steps, they are required for keeping yourself active. More than 10,000 steps they are required. But what type of the steps they are taking? Because our watch that will be counting the step even if we are slowly walking. But bone strength will be increased with the thumping of our lower limb. If we are jumping, jogging, dancing, that is going to increase the bone density. Simple walking is not going to increase the bone density. So that type of thumping exercise, when there is impact of the lower limb over the ground, that's going to matter a lot. But definitely, if a person is just taking care of their steps, then more than 10,000 steps should be there. But we should tell them that that should be impact exercise that should be done. They are most important.
Yeah, I think that's very relevant because just normal walking, because the app counts the normal steps also. But
Yeah, yeah,
most
yeah, yeah.
important is load bearing and impact exercises, which
Yeah, yeah, yeah.
impact
So
on the bone.
load bearing or impact exercise, that's why I have demonstrated that weight bearing exercises, they are important. Even cycling is not a weight bearing exercise. Sometimes people, they are doing 15-kilometer cycling, 20-kilometer cycling. That will strengthen the muscles of the lower limb, but the bone strength will not be increased that much as it is with the weight bearing exercise.
Actually, point is also na, it's all about your bone as well as your mobilization of the joints.
Yeah.
So cycling and all those things, they also help in the strengthening of your
Yeah,
muscles, the
they
joint
help in
strengthening of your
increasing.
joints like
Yeah.
that. So keeping the healthy joints like that.
So
So
ultimately, as Dr. Manoj has pointed out, we should start motivating them to start exercising at early age,
yes,
after 40. And we all know that wear and tear starts after the 40 year. Most of the patients, they start experiencing knee pain after 40. So that's the right time when they should start indulging in the doing some type of the exercise seriously. maybe 3 days a week, 4 days a week, 5 days a week, depending upon how much time they can find out. But if they will gradually develop the help of doing the exercise, that will go along with. Whenever they will reach at the age of 60 or 70, they will be relatively active as per their periods of the age. So I hope all members of the Delhi Orthopaedic Association, they are already keeping themselves active and fit, because daily I am seeing that sometimes you are organizing walkathon, sometimes you are organizing cyclathon. So it means you are keeping yourself fit under the leadership of Dr. Ajay Shukla nowadays, along with Dr. Karun and Dr. Sandeep Kumar.
I think thank you very much, sir, for the wonderful discussion. Each and every point was very, very important. And definitely, we will try to be inspired as well as try to imbibe all these things in our day to day life.
Thank you,
I
sir.
think
Thank you very much.
one last point which I would like to just add on to this discussion is we talked about that we should start the exercise at the age of 50, 60, or 40. A
Yeah,
day before yesterday, we were having a webinar, and I pointed out there also. I think earlier in school, we were told that you have to do exercise, and there was a physical activity period or 15 minutes at a time which was compulsory for all the students to do
very true.
exercises.
Very
But
true.
nowadays I see the schools have just erased this thing, and none of the schools is practicing. The students are just sticking to their mobiles, to their laptops, to their tablets, and I think that is the place where we should try to make them aware.
Yeah,
I
yeah, yeah,
I
yeah.
think the government and the association should actively participate and try to sensitize this issue that look, if you train these students in this age, so at least they will learn what to do and how to do and what is the importance. As you rightly said, what, where, how, all these needs to be answered, these questions. So I think we need to train them so that it gets into their daily life activity, that this is a part of their life. So if you start asking them to do at the age of 50, 60, I think 50% of the people they don't understand that it is really important for them. उनको लगता है अभी तक तो हम बढ़िया चल गए आगे भी चलते रहेंगे हमें क्या होने वाला है
नहीं फिर से
बट
फिर
Yeah,
से
very
हरिओम सर
right.
को बुला लेंगे लेक्चर के लिए.
That is Sandeep, you are very right that we should catch them young.
yes,
But the problem is that because of the professional career pressure, most of the students, they just continue this type of the habit.
because you will see, sir, so many students coming to you, even the software engineers, the people those who are sitting on a laptop at even at the age of
They are
18,
coming
20,
from the
20,
backache problem.
they are
So
coming
many.
for the backache.
Huh.
So basically the muscle strength is zero.
Yes, yes, yes.
So if the muscle strength is not going to be there, definitely it will lead to the osteoporosis as
Yeah,
well in due
yeah,
course
yeah,
of
yeah.
time. So
And
I think the
at
sarcopenia is also a very important topic which we need to
yeah,
understand along with the osteoporosis,
yeah, 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 yeah.
which is
We
also
will
among one of the silent killers.
we will discuss in the separate webinar on sarcopenia.
And in these type of the software engineer patients, simply going to the gym will not help. We need to strengthen the back muscles. That can be done by the just simple back strengthening exercise, which can be done at home only. So we need to make them understand that how to do the exercise, how much exercise should be done. Only then our purpose will be fulfilled.
Thank you, sir. Thank
Thank
you
you,
very
Hariom
much.
sir. I think today's lecture was so enriching, and especially the discussion part. So definitely would love to invite you next time also.
Thank you.
So
Soon.
Thank you.
thanks. And
Thank you
Sandeep
very
sir,
much, sir.
thanks. Just to
And
wrap up
Thank you.
now,
if I
Sandeep
have
sir,
been
it's
able
over
to
to you now
justify
to wrap
my
up.
if I have been able to justify my talk, it's really that I have made my day, and
नहीं
my
नहीं
mission is
you,
completed.
sir. I think with this continued commitment, we would like to see you like Fauja Singh.
I think Ravi, immediately after we leave this webinar, 15 minutes of exercises all of us should do. We should take a pledge that that we will do 15 minutes of
Vinay,
either a brisk walk or whatever.
Vinay must be ready with the dumbbells and all those things.
Thank
Absolutely,
you.
yeah.
So I
So
think Ravi, you can just wind
it
it
was
up
nice,
now.
sir. It was nice, Hariom sir. So
Thank you,
Sandeep sir,
sir.
please
Thank you so much.
wrap up the thing, sir.
Yeah.
Sandeep
Thank you
sir,
very
please
much.
wrap up
Thank
the
So
thing.
you.
yes, I think thank you very much all the participants and Dr. Hariom sir. Thank you very much for such a knowledgeable and good
Thank
webinar,
you. Thank you,
and
sir.
we will
Thank you.
definitely see you soon. Thank you.
Thank you.
Thank you, sir.
Thank you, Ravi.
Thank
Thank
you.
you, Vinay. Thank you, Karun. All of you.
Thank you so much. Thank you.
Good
very
night, sir. Good night.
much. Good night.
Right, sir.
Good night. Jai Hind.
Jai
Jai
Hind.
Hind, sir.
Yeah.